Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, get peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In today's video blog, I want to answer a question from one of our clients. And the client, Nancy, writes in and she says, my brother is 58 years of age. He had an accidental drug overdose on pain medications, opiates to be exact. He has been in intensive care now for 7 days. I'm really at a loss of what to do, and I don't know what questions I should ask, and I don't know how I should manage the doctors and the nurses. Well, Nancy, the good news is that's exactly what I can help you with. So let's go back to the emails that you've sent, and I'm just going to read them out from the conversation that we had. So, Nancy, it would be very good to know what his current condition is exactly like, and if he's in a natural or in an induced coma, and also is he on a ventilator? Because if he's had a drug overdose, it could well be that he's in a natural coma because of the drug overdose. So Nancy then writes back, hi Patrick, he is no longer being sedated under medical induced coma. He's on a ventilator with a breathing tube and a feeding tube through the nose. He has surgery scheduled for a tracheostomy on Tuesday. The registered nurse said he will also have a peg placed for feeding. Also, he is on kidney dialysis because the kidneys are failing and his liver enzymes are very high. It's all very new to me. I'm not sure what questions to ask the medical staff, and I wonder, will my brother pull through this? Also, if he does, what will his quality of life going to be? So those are all great questions, Nancy, because the biggest challenge for families in intensive care is simply that you don't know what you don't know. You don't know what questions you need to ask, and you don't know how you need to manage doctors and nurses in intensive care to get the outcomes that you want for your brother. So let's go through almost like a checklist of what questions you need to ask in a situation like that. So you're saying your brother is not in a medically induced coma anymore, so you want to know what's his neurological condition like at the moment. So can he wake up? Is he obeying commands? Is he in pain? If he can't answer yes or no whether he's in pain, is he showing signs of pain non-verbally? Does he look like he's in distress? Can he move all limbs? Are his pupils equal and reactive to light? Those are all very important questions. Another issue that can happen after a drug-induced overdose is, does he withdraw from the medications or from the drugs that he sometimes takes outside of ICU? And if he's withdrawing from those drugs, is he at risk of seizures and other withdrawal symptoms? And do they need to be managed medically with other medications? So that's what you need to look for neurologically. Next, you need to find out if your brother is hemodynamically stable. So for example, is his blood pressure normal? Is his heart rate normal? Is he in a normal heart rhythm? Is his blood pressure normal? Is he on inotropes or vasopressors, or is he on vasodilators? He would be on inotropes or vasopressors if he has a weak heart or if he has a low blood pressure. He would be on vasodilators if, for example, he had a high blood pressure or a hypertension, right? Is your brother febrile? Does he have a temperature? Is he warm in his limbs, right? Again, is his heart rate normal? Is he in a regular heart rhythm? Does his heart beat fast? Does he have a tachycardia, for example? If he has a temperature and a tachycardia and a low blood pressure, does he have an infection? Then blood results. You need to look out for blood results such as hemoglobin, white cell count, again to look for an infection, or CRP to look for infection markers, right? You mentioned the liver enzymes. need to watch out for them. You need to watch out for kidney markers and kidney results, blood results in particular, if he's on dialysis. So with the overdose, his kidneys might have taken a hit and he might need temporary dialysis. So those are things that you need to look out for. Also, if he does have a temperature and a tachycardia, high heart rate, and a low blood pressure, what's his lactate like? And again, that could be another sign of infection if his lactate is high. Next, does he have a central line or an arterial line, which gives him IV access, intravenous access, a central line in particular, again to manage medication such as sedation, opiates, as well as vasopressors or inotropes. Arterial line is necessary for the ventilation and the breathing tube because you can check arterial blood gases to check oxygen levels in the blood, carbon dioxide levels in the blood, electrolyte levels in the blood, such as potassium in particular, right? Which is important if your brother is on dialysis. You got to check regular potassium levels. So with the arterial line, you can also check the whether ventilation is physiological or not, or whether ventilation parameters need to be adjusted. That leads me to the next thing. Leads me to mechanical ventilation. Your brother is on a ventilator. How far away is he from getting off the ventilator, right? You are talking about that they've got a tracheostomy scheduled on Tuesday. So it's likely that your brother is not ready to come off the ventilator and that they think he won't be ready for a while because he'll have a tracheostomy by the looks of things. So find out what ventilator settings he's on, and then I can guide you from there what to do next. Is he close of coming off the ventilator? Is the tracheostomy the right thing to do? Send me a picture of the ventilator and the monitor, and then I can tell you what he's up to. Send me the blood results and I can interpret them for you. The tracheostomy as well as the PEG have a permanency about it. And I don't like it because, why would you have a permanent PEG? Hopefully the tracheostomy is temporarily. Hopefully they move your brother towards weaning off the ventilator as quickly as possible. Then the nasogastric tube he's got in his nose should be more than sufficient. Questions to ask about ventilation as well are: how much oxygen is he on? How much PEEP is he on? How much pressure support is he on? Is he breathing by himself, or does the ventilator do all the work? What are the arterial blood gases like? Those are some of the questions you need to ask in order to determine, is your brother able to come off the ventilator without needing the tracheostomy? Because the tracheostomy could be a long-term thing, a long-term device, and you don't want that unless it's really, really necessary. Next, does your brother get enteral feeds? And is he, more importantly, absorbing those feeds? Can he tolerate them? Is he opening bowels regularly, right? Is his tummy soft? If his tummy was distended and he hasn't had his bowels open for many days, that could put pressure on his lungs, and it could be an obstacle to get your brother off the ventilator. Again, it all comes down at this point in time to avoid the tracheostomy. Even your brother's tummy is important because, again, if he hasn't had bowels open for many days and his tummy is distended and firm, it puts pressure back on the lungs, and it may be an obstacle to get your brother off the ventilator. Kidneys. You mentioned kidneys earlier. Your brother is on dialysis. So we're moving, as you might see by now, we're moving from head to toe. We've gone from neurological assessment. We've gone to cardiovascular assessment. We've gone to respiratory assessment about the breathing. Then we've gone to the abdominal assessment with bowel movement, absorbing of feeds, all of that. And now we're moving downwards towards the kidneys. So why is your brother on dialysis? Have the kidneys failed completely? Is he producing urine? Or is it just that he doesn't produce enough urine and they're removing more fluids, again, to help your brother as well to get off the ventilator? The more fluids they can remove, the more likely it is the lungs are dry, and that will help with removing your brother off the ventilator, with weaning him off the ventilator. And again, maybe he won't need the tracheostomy. Other things you need to look for is general condition. Is he getting good nursing care? Is he getting daily washes? Is he getting mouth care? Is he getting pressure area care? Is his skin intact? And all of that. And also you mentioned the liver enzymes are high, and that could be simply a result of the opiates that your brother has taken and the liver not coping. And also the induced coma that your brother was in, he was getting some propofol, maybe some midazolam or Versed, some morphine, some fentanyl. That's all impacting on the liver enzymes as well. So then, Nancy, you are saying that you're asking, when is a tracheostomy the right thing to do? Well, the tracheostomy is the right thing to do after, let's just say, 10 to 14 days, especially if he's not waking up, right? And if he's waking up and he can obey commands and he can breathe by himself, he has minimal secretions, his chest x-ray is clear, and he can cough, and the arterial blood gases are fine, then your brother should be able to come off the ventilator. I also need to share with you that, you mentioned that you are in Pittsburgh in the United States, Nancy, that if your brother ends up with a tracheostomy, there's a very good chance your brother might be sent to an LTAC facility, long-term acute care facility. And that's a disaster from my experience, right? The LTACs are just designed to get patients out of ICU quickly without looking at clinical need. They're really a vehicle to save money and free up beds in ICU, and a lot of patients die in LTAC. So it's really important that you make the right decision going forward, right? Without, putting your brother at risk. You're saying that he's been out of the induced coma now for 3 days, and that today he's awake and he's communicating by opening his eyes and raising his eyebrows. He continues to be on the ventilator, and the ICU nurse reports his oxygen is down to 30%. I assume that his kidneys and liver enzymes are high as a direct result of the opiate overdose he's had a few days ago. The ICU nurse said that the opiates was a painkiller with Tylenol and that it's hard on the kidneys. Yeah, the ICU nurse is right. Tylenol is hard on the kidneys, hard on the liver, and it makes the liver and the kidneys fail. So hopefully the dialysis is just going to be temporary and the kidneys and the liver will recover. If oxygen is down to 30%, that's a good thing, right? It means that, if the PEEP is down, as well as the pressure support is down to less than 10, PEEP less or equal to 5, and he's obeying commands, arterial blood gases are good, and he's breathing by himself, he doesn't need a lot of endotracheal suctioning, he should be able to come off the ventilator, right, without the need for the tracheostomy. And then I had another update from Nancy as we went along during our consulting sessions, and Nancy said in another email, hi Patrick, I went to ICU today and the doctor did say that my brother is not showing any brain damage. He even told me that his liver enzymes are improving and he's on dialysis just once a day. They tried solid foods on him today, but his throat is still swollen because he had the breathing tube out yesterday. They will try again with solid food tomorrow. And obviously now that the breathing tube is out, he has no tracheostomy or PEG surgery. So I'm really very grateful for your advice, and I continue to read and watch your material that you send, and I'm telling everyone about you. Thank you again for all your kindness and your help. So Nancy, that's really great that your brother came off the ventilator and the breathing tube, and that he doesn't need a tracheostomy and that he doesn't need a feeding tube. And for you watching that you are having a loved one in intensive care, keep in mind the intensive care team is always giving you the worst case scenario. The ICU team will always look at the worst case scenario. They will never tell you the full story, and they will just cover themselves. And by covering themselves, I mean, they will just tell you that, your loved one is going to die, they will need a tracheostomy, they will need this, that, and the other, just simply because if they were going to tell you, hey, Nancy, your brother will be in ICU for another week and then he'll go out of ICU and he'll recover and all will be hunky-dory, they could be in big trouble if that isn't going to happen. So you always have to read between the lines that they will always give you the worst case scenario, even though your loved one may be at, going to a hospital ward soon, right? Always need to read between the lines. And you always need to ask for professional help, because intensive care is such a highly specialized area, as you would have known by now. You don't know what you don't know. And there are sometimes 10, 20, 30, 40, sometimes even 50 things happening simultaneously in a critically ill patient. And every little thing is a piece of the puzzle, and it's very important. And if you haven't worked in intensive care for a long time, like I have, I've worked in intensive care for 20 years, it's hard for you to interpret any meaning into the situation, and it's hard for you to ask the right questions if you don't know what to look for and if you don't know what to ask. So that's it for today. So Nancy, thank you again for being a client. So how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence quickly when you download your free instant impact report now by entering your email below. In your free instant impact report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of the website. Also, have a look at our ebooks, and you can also get one-on-one consulting and advocacy with me over the phone, via Skype and via email by clicking on the relevant tabs on the top of the website or by simply giving me a call. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.